In this section, we'll start looking at enzyme inhibitors. And so within this section, we'll be looking at the processes of reversible and irreversible inhibition. Okay, so first of all, we'll have a look at reversible inhibitors and the idea behind them and what we can use them for. Now, enzymatic function relies on a careful balance of binding interactions. So we have our substrate, which is trying to enter into the active site of the enzyme. And when it does, the enzyme will undergo an induced fit, which will form binding interactions between the enzyme and the substrate. Now, the reaction will then occur, which will result in the loss of a product. But ultimately, the remaining product needs to unbind from the enzyme and be released into the environment. Now, if the product is not released, it blocks the active site of the enzyme and it stops the next substrate molecule from entering into the enzyme and reacting. Now, this idea of having a substrate molecule and a tightly bound molecule in the active site compete is the idea of competitive binding. So if we can design a drug that has stronger binding interactions with the enzyme than the substrate does, we can introduce this molecule, it'll bind to the enzyme, as we can see here, but it then won't be released, and it will block the substrate from entering into the active site. And when it does this, it inhibits or switches off the enzyme function. Now, this is the idea of competitive binding. We have a substrate that's competing with a drug molecule for the same binding site. And if we make a drug molecule that can bind more tightly than the substrate, we can use this to reduce the production of products by an enzyme. Now, this process is not a permanent process, so there will be an equilibrium in solution between the enzyme in this form, where you have a drug molecule and an enzyme separately, and the form where you have the drug molecule bound into the enzyme. Now, this is an equilibrium, so it's a reversible process. Over the entire population of enzymes in a solution, you may have thousands upon thousands of enzyme molecules. Some of those will have the drug bound and some will have them unbound. And the more we can increase the binding strength between the drug molecule and the enzyme, the longer the drug molecule will stay in the active site. And that will shift the amount that we have that is bound and therefore not available for binding by the substrate versus unbound, where substrate or drug molecule could enter into. Now, as this is an equilibrium process and is reversible, increasing the natural substrate will displace our drug molecule, and it'll displace it and allow the substrate to enter into the enzyme. So if we increase the concentration of our natural substrate, we can displace our drug molecule, and this will decrease the effectiveness of the drug. However, it could also act as a safety mechanism. If you were to, say, overdose on a competitive inhibitor, you could introduce the natural substrate to displace that inhibitor and reduce its effect. So we have this, the drug binding into the enzyme as an equilibrium process. That means it is a reversible process, and increasing the natural substrate concentration will decrease the effectiveness of the drug molecule. And this is the ethos behind competitive binding, the idea of this competition between bound drug molecule and the substrate trying to bind into the active site. So, drinking antifreeze, is it a good idea? Of course, the answer is no, but I'm going to show you how the treatment for drinking antifreeze actually relies on knowledge of the enzymatic reaction that occurs with the components of antifreeze and how we can prevent this by getting someone to drink alcohol. Now, one problem that we have with competitive inhibitors is that they are displaced by increasing levels of the natural substrate. So if you increase the levels of the natural substrate, the inhibitor is displaced from the enzyme and normal activity can be resumed. However, in some cases, we can actually turn this to our advantage, and this offers a possible treatment pathway. Now, the main ingredient in antifreeze is ethylene glycol. Now, ethylene glycol is oxidized to oxalic acid by a series of enzymatic transformations. Now, unfortunately, oxalic acid is particularly toxic, and therefore oxidation of the ethylene glycol to form oxalic acid is a process that can be incredibly harmful. Now, blocking the synthesis of oxalic acid will allow someone to recover from antifreeze poisoning. So if they have decided to drink antifreeze, blocking the synthesis of the oxalic acid will allow the ethylene glycol to eventually be excreted. But to do this, we have to block the synthesis of the acid. So we have to block the enzyme from converting the ethylene glycol into the acid. Now, the first step in this reaction is oxidation by alcohol dehydrogenase. So what we can see here is we have our ethylene glycol, and this undergoes transformation through alcohol dehydrogenase, and this oxidizes the alcohol to give you an aldehyde. Now, this is then further reacted to eventually give you oxalic acid here, which is incredibly toxic. Now, ethylene glycol is an unnatural substrate for alcohol dehydrogenase, so it is not the natural substrate for this enzyme. Now, increasing levels of the natural substrate will increase competition for the active site, which will ultimately inhibit the binding by ethylene glycol. So if we increase the amount of natural substrate, the ethylene glycol won't be able to bind, and it will eventually be able to be excreted. Now, oxalic acid production will then be inhibited, which will allow the ethylene glycol to be excreted. So if we can increase the level of the natural substrate, we have a route to preventing the oxalic acid production. Now, just to show you what is happening, if we have a low level of the natural substrate and a high level of the ethylene glycol, our natural substrate is not able to bind because the ethylene glycol will enter into the binding site. The alcohol dehydrogenase will undergo an induced fit, perform the reaction, converting it into the aldehyde, and this will then be removed from the enzyme, allowing the enzyme to perform the reaction again. However, if we add a large excess of the natural substrate, this will outcompete the ethylene glycol. So if we provide enough of the natural substrate, we can prevent the ethylene glycol from binding, stop the aldehyde from being produced, and ultimately prevent the production of oxalic acid. Now, when the alcohol binds instead, it reacts normally with the alcohol dehydrogenase and then releases a safe product. Now, in this case, the natural substrate is alcohol or ethanol, and so a cure for drinking antifreeze is to drink alcohol. It will outcompete the ethylene glycol present in the antifreeze and stop the oxalic acid production. Now, when we're looking at the design of reversible inhibitors, we need to ensure that the drug is recognized by the active site. And this is because the drug has to enter into the active site and bind strongly to it. Now, what this means is that drugs that are designed to act as reversible inhibitors often have the same or similar functional groups to the natural substrate. So often these molecules are quite similar to the substrate itself. Now, the molecule may also have extra functional groups, additional groups, to allow extra binding interactions to occur and to hold that molecule in the active site more tightly. But the key is that the molecular structure of it is likely to be similar to the natural substrate. Now, the drug doesn't have to mimic the substrate itself as long as the drug can fit into the active site. So it doesn't actually need to undergo the same reaction as the drug or anything like that. It just needs to be able to fit into the site and bind strongly. Now, it could be that our drug molecule uses different side chains within the active site to adopt a binding interaction. But the key is it's got to fit into that site and bind. It doesn't matter which groups within the site it uses. Now, the drug could also mimic the product from the enzymatic reaction rather than the substrate. So it could mimic the product and still adopt binding interactions within the active site that enable it to be held in place. Now, the drug could also bind to the active site but not be in competition with a substrate. Instead, it could compete with a cofactor that is required for the reaction to occur. So it may take multiple molecules in the active site to facilitate the reaction. And in this case, the drug could compete with the cofactor instead of with the substrate itself. And so there's lots of different options for the design of drugs designed to be competitive inhibitors. We can use the natural substrate as a guide to give us an idea of what functional groups we need and where we need to put them. But we can also make lots of changes to those groups, and we can exploit either the chemical groups that the substrate exploits, or we could exploit different ones. Really, this would require an extensive testing process to work out what the optimal groups are and what the best arrangement of those groups on the molecule is. Now, in contrast, irreversible inhibitors bind irreversibly to an active site. Now, this is normally by forming covalent bonds with amino acid side chains that are present within the active site. Now, two amino acids that are able to do this quite readily are serine and cysteine, which you can see here. So here we have serine, which has an OH group on its side chain, and here we have cysteine, which has an SH group. Now, these side chains are nucleophilic, and therefore electrophilic drugs will react with these amino acids. So if we know there are serine or cysteine residues, side chains, present within the active site, we can build a drug that will be able to react with these amino acids and form an irreversible covalent bond. This will then lock the drug into position. Now we can see this in the diagram at the bottom. So we have our drug here, which enters into the active site of our enzyme. Our drug will contain an electrophilic group, which the nucleophilic side chain, in this case an OH group from serine, is able to react with. Now what we can see here is the side chain reacting, and after it's reacted, it forms a covalent bond, and this drug will be permanently locked into the active site. Now this is irreversible inhibition. No amount of natural substrate is ever going to displace this drug molecule from the active site of the enzyme, because it's held in by a permanent and irreversible bond. Now, one example of an irreversible inhibitor is the anti-obesity drug orlistat. Now, this drug is able to bind irreversibly to pancreatic lipase. Now, digestion products from fat in the diet are used in the synthesis of fat within the body. Now, inhibition of this pancreatic lipase will inhibit the digestion of fatty acids from the gut, and ultimately this will lead to lower levels of fat production in the body. So the way that orlistat works is that it approaches the pancreatic lipase and it's able to react at this position with a serine residue, or a serine side chain, so an OH group. This OH group reacts and forms a permanent covalent bond with the orlistat. Now this then permanently inhibits the pancreatic lipase and reduces the digestion of fatty acids from the gut. This lower level of fatty acids being digested means that you have less of the fatty acids available for production of fat within the body. Now, when we're looking at inhibitors, when we're looking at our options for inhibitors, reversible inhibitors are preferred over irreversible inhibitors. Now, the reasons for this is that firstly, irreversible inhibitors contain functional groups which can react with other biological molecules, and this can result in some really nasty toxic side effects. Now, what I mean by this is they contain functional groups which not only will react with their intended target, but could also react with other proteins or even nucleic acids, such as DNA or RNA, within the body. Now, this off-target binding will cause significant side effects, and this will obviously cause a serious problem for the patient. And therefore, drugs which form a permanent covalent bond in this way are not preferred when we're trying to develop new compounds. Now, irreversible inhibitors are also not preferred because we have no way of undoing the damage that they've done. So if we were to give a reversible inhibitor and there was an overdose, we could simply administer more of the natural substrate to be able to displace the reversible inhibitor and stop its action. We don't get that option with irreversible inhibitors. Now, irreversible inhibitors are not competitive since they're permanently bound to the active site of the enzyme. Now, what this means is that if we introduce a drug to knock out a biosynthetic pathway, if we only knock out part of the pathway, we could have a build-up of substrates from previous steps within that pathway. Now, the build-up of other substrates could be toxic and could also result in toxic side effects. Now, just to give you an example of the effect an irreversible inhibitor can have, we're going to have a look at monoamine oxidase inhibitors. Now, these have been used as antidepressants, and monoamine oxidase inhibitors affect levels of all neurotransmitters that are metabolized by the monoamine oxidase enzymatic pathway. Now, this leads to the build-up of both dopamine and serotonin. And we have some examples of monoamine oxidase inhibitors shown here. So these are just a set of 4 different examples. Now, these inhibitors also interact with other drugs and with food. Now, ripe cheese contains a compound called tyramine. Now, tyramine is normally metabolized by monoamine oxidase in the wall of the gut and within the liver as well. Now, the problem is if monoamine oxidase is inhibited by an irreversible inhibitor, such as the monoamine oxidase inhibitors, then the tyramine is not metabolized. Now, this is a problem because the tyramine then enters into systemic circulation. Now, this causes acute hypertension and severe headaches, which is obviously unpleasant for the patient. Now, a reversible inhibitor would be displaced by increased levels of ingested tyramine and allow metabolism to occur. So if we used a reversible inhibitor instead of an irreversible one, that increased level of tyramine in the diet or in the gut would then displace the inhibitor itself. But because these are irreversible inhibitors, that doesn't happen. And so when things like ripe cheese are eaten, it means that the patient can experience severe headaches because of the acute hypertension. And so this is one example of why reversible inhibitors are preferred over irreversible. Essentially, we can undo any problems that are caused by reversible inhibitors simply by adding in extra levels of natural substrate. This is not an option with irreversible inhibitors because a permanent covalent bond is formed and those enzymes are permanently deactivated. There's no way for us to remove the drug molecule from the enzyme itself. In the next section, we'll be looking at how inhibitors can bind at allosteric binding sites to inhibit enzymatic activity. We'll also be looking at uncompetitive and non-competitive inhibitors, as well as transition state analogues.